Good morning, guys. I ain't real sparkly. Today is my admin day. I have finally caught up on emails. I do try and respond within 48 hours, but sometimes the workload is utterly insane and it takes me a little bit longer. I'm going to go back in 10 minutes, having cleared emails, cleared tasks, and there's going to be more emails and tasks. The work does not stop. It's 24/7. And remember, nobody cares, work harder. So I'm always trying to act in your best interest. So we had an email from a guy the other day who was 19 years old. Now, what does a 19-year-old need TRT for? He's 19. He should be fighting fit. He's seeking testosterone replacement therapy to obviously alleviate the negative symptoms that he's presented with. And we always talk about testosterone deficiency being a diagnosis of exclusion and looking to do everything in your power to reverse it through lifestyle, stress reduction, sleep hygiene, avoiding booze, a healthy diet, engaging in regular physical exercise and having a positive mindset. So yes, try not to need TRT. But why does this guy at 19 years old potentially need testosterone replacement therapy? Well, at 16, the poor guy had testicular cancer and he had a subsequent orchidectomy. Now, an endocrinologist will say, the other one will pick up the slack. Come on, you got two for a reason. So this guy had struggled for 3 years with symptoms of low testosterone, and he'd had a recent review by the endo, and he was told that he was well within the normal range at 12.7 nanomole per litre. Now, as you know, the reference range is lowering because we live in a sick society. So yes, perhaps for the normal, not normal, average sick population, 12.7 is considered normal. No, it's not normal, is it? Now, we adhere to the BSSM guidelines, the British Society for Sexual Medicine guidelines. Now, they stipulate that you can be considered for a trial of testosterone replacement therapy if you have a testosterone of less than 12 and a free T of less than 0.225. Now, even that's pretty draconian because lots of guys with testosterone slightly higher who are putting the work in need testosterone replacement therapy. Does that mean that you should just jump on TRT? Now, as we said already, look to try to not need TRT by addressing all the things that you can address because TRT is involved. Time, effort, money. Come on, give me some money. Listen, the Men's Health Clinic is a private medical clinic, but we will always act in your best interest because it serves me no purpose to put you on testosterone replacement therapy if I don't think you clinically need testosterone replacement therapy because you won't feel the benefits. Because if there are things that you need to be doing to amend the negative symptoms, like addressing your sleep, your stress, your booze, your nutrition, your exercise, and having a positive mindset and being the best version of yourself, you've got to do that anyway. So do it. So don't jump on testosterone replacement therapy. But this poor guy, 19 years old with a total testosterone of 12.7 and being told by the endocrinologist, you're well within the normal range. What's he supposed to do? He can't it's utterly insane. So you must always have a considered approach to the patient. Now, there are lots of online companies out there who will take your money and say, sorry, you don't qualify for TRT. So what should I do? Boom, closed door. Now, we get lots of inquiries from patients and often they don't need testosterone replacement therapy. So I give them some advice. I give them the necessary tools to hopefully go forth and become better versions of themselves. Now, I give them some practical information. Try to optimize your natural testosterone level through stress, sleep, what we all talk about all the time, micronutrients. Seek advice from the GP if necessary. To try and signpost them to the appropriate resource to hopefully allow them to feel better. Because you can be pretty despondent with symptoms of low testosterone, but they're all quite vague, aren't they? Tiredness, brain fog, low libido, low mood, erectile dysfunction. Not everything is testosterone deficiency. And as we've said numerous times before, testosterone deficiency is a diagnosis of exclusion, which is why we always suggest getting a comprehensive blood screen as opposed to one of those preliminary finger prick tests that are notoriously unreliable. So more information, more power to effectively advise the potential patient of what he can do to not need TRT. Now, TRT can be utterly life-changing. We had a guy in for his 6-month bloods today. Super young guy. Again, 19 years old. The first time he came in with his mother. His mother did all the talking. We had a very long, protracted conversation about, is this in his best interest at this age? And he had clinically low testosterone levels. So yes, he did qualify for TRT, but should he go on testosterone replacement therapy? So we didn't rush into starting him on therapy. We gave him the normal advice about what he should be doing. And we wanted him to be confident that this is in his best interest. Because again, do I qualify for TRT? Well, yes, you do. But is it in my best interest? Well, I don't know. We've just got your blood test and you qualify for jump on. It shouldn't be like that. You should be having a considered discussion with your potential prescribing clinician about what is in your best interests. It's not just you qualify for TRT. Should you go on TRT? So this guy, 6 months down the line, didn't come in with his mum, shoulders back. He started a new business. He is utterly flying. He has gone from a boy to a man. So testosterone replacement therapy can be utterly transformatory. And we talk about reversing the negative symptoms. And again, that would be what you want to do. But again, once you've done that, what are you going to do? Well, you're going to be the best version of yourself. And what does that take? That takes effort. Now, if you struggled before, we've all struggled. We all struggle and we continue to struggle, but we decide not to struggle and we decide to be proactive and make today the best day of our lives by being considered about everything. And we take about testosterone being the calming hormone, testosterone in the previous video, allowing you to be resilient, but ultimately it's always up to you. Now, past indiscretions, they're in the past, mate. Let's move forwards. Let's concentrate on the now to have a considered future. I always think to myself, I want to be the best version of myself. Is that what I think? I think, how good could I be if I don't do the things my stupid brain wants me to do and I do the things I should do? And all those things take effort. And you will see the reward if you put the effort in, but you've got to put the effort in, because taking the path of least resistance is so tempting, and we've all done it before, and we've all gone, yeah, short-term gratification, long-term loss, but we still do these stupid things. So again, testosterone is not going to make you the superhuman that you want to be. You're going to make yourself the superhuman that you want to be by making the right considered decisions every single moment of the day. That's the key. We have wonderful goal setting. And once that goal has been achieved, there's an emptiness, there's a nothingness, because it's not just about the goals. It's about making every single moment productive. Now we talk about, again, earn your reward. With the reward being an illusion, the actual effort is the reward. And when do you need to apply effort? Right now. So it is all about this moment. There's really nothing more to say apart from, you guessed it, go earn your reward.